I want to begin by acknowledging the hard work of my predecessor. Minister Fullerton led the ministry through the COVID-19 pandemic while making progress on our government's commitment to repair and rebuild Ontario's long-term care sector. Ontario's long-term care sector is home to our most vulnerable seniors. As the new minister, I am responsible for rebuilding and repairing this sector after decades of neglect. We recognize that there is a tremendous amount of work still to do as we learn the lessons of the pandemic and make our long-term care homes a better place for residents to live and a better place for staff to work. Now, I spent my first week listening and learning from people in the long-term care sector. I've been impressed by the enormous reservoir of goodwill that there is to improve the lives of residents, their families, and staff. One thing that I've consistently heard is the importance of safely increasing the number of visitors and a return to a more normal life for our residents. And that's why I'm pleased today to announce that we will soon be able to safely ease restrictions on our long-term care homes. As we head into the summer, Ontario's roadmap to reopen will mean more family, more friends, and fewer restrictions for all Ontarians, and that will include long-term care residents. When the province moves to Step 3, we will be lifting the limits on outdoor and indoor gathering numbers, so long as public health measures are in place to ensure safety. We'll be easing restrictions on dining and allowing more social activities like dancing, singing, and off-site excursions. As I said, we're all looking forward to Step 3, but as you all know, we're not there yet. So as we prepare to move into Step 2 across the province tomorrow, Ontario's long-term care homes are getting ready to begin to safely open their facilities for more visitors. As of July 7th, residents will be able to have as many designated caregivers as they need. Up to 10 people can visit a resident outdoors. All residents can have an indoor visit with 2 visitors and 2 caregivers. And personal care services, like hairdressers, will be allowed in the homes. We are giving the homes until July 7th so that they have the time to put in place these changes in a safe fashion. These changes are only possible because of the cooperation of all Ontarians, the incredible efforts of our long-term care staff, essential caregivers, and most importantly, residents to get vaccinated. As of today, across Ontario, 99% of long-term care residents are fully immunized, and more than 92% of long-term care staff have their first doses, while 84% have both doses. This is good news, but we need to remain vigilant. Long-term care homes will continue to actively screen everyone who enters, conduct asymptomatic surveillance testing, and ensure strong infection prevention and control measures are in place. I've spoken with Ontario's new Chief Medical Officer of Health, Dr. Moore, and he and his team support these changes. I look forward to working with him and wish him success in his important new role. Homes will also continue to follow local public health guidelines, and later today I'll be speaking with local medical officers of health to ensure that these important partners are fully briefed on our plans. As these changes come into effect, we will continue to monitor the situation, and we will only further ease restrictions when it is safe to do so. For residents and family members who want more information on these changes, you can find the full details at ontario.ca/LTC family visits. Once again, for more information on these changes, you can find all the details at ontario.ca/LTC family visits. We are cautiously and safely reopening the province, and no one deserves to enjoy the reopening more than the residents, families, and staff of long-term care. We'll continue to make safety and well-being of our residents a top priority as we move forward. Thank you, and I'll be pleased now to take your questions.
So we'll go to the floor for questions first. Just a reminder, it's one question, one follow-up.
Okay.
Minister, why did this take so long? It was back in January when we saw really high vaccination rates when it came to residents, and we saw the case numbers and transmission rates in long-term care homes starting to drop. It's July almost. Why did it take so long for the government to lift all of these restrictions on long-term care homes?
Colin, the safety of our residents and their staff, or our staff, is at the top of our priority. We wanted to make sure that not just vaccination rates inside of the homes, but that community vaccination rates reached the level they did. And I think we're at over 75. I think I saw 77% first dose, and now in excess of 30% of second dose across the province. So this is a combined effort, obviously with the advice of Chief Medical Officer and the science table, to make sure that we move as quickly as possible, but in a way that's sustainable. So I'm comfortable that first and foremost, these changes on July 7th will open that door. But very importantly today, what we're talking about is that as we move into step 3, and as we know, we don't know exactly when that'll be, long-term care homes will be able to move in tandem with the rest of the community.
So can I ask you about step 3, because you're saying that this is kind of harmonizing the long-term care plan with the roadmap to reopen. So is July 7th then the date for step 3?
I believe that will be a conversation that we'll be having with the medical officials as to step 3. It'll be a function, as you know, of levels of vaccination, but also a variety of other measures. But yes, the important part of today, of course, it's great that on the 7th we'll see these measures, we'll see more guests, we'll see unlimited caregivers. These are things that advocates told me were very important for families. And then when the province is able to move into step 3, and we're able to do so safely, long-term care homes will move at the same time.
So your predecessor was took no responsibility for what happened in long-term care. She had said that, quote, we didn't start the fire. Your government didn't start the fire. That there were already issues that you say as well now that it's a neglected sector. What level of responsibility does your government actually take here for everything that happened in long-term care homes during COVID-19?
Colin, I think that anyone who has read the Long-Term Care Commission report can't miss the clear conclusion. Successive governments, including this one, failed residents, they failed families, and they failed our staff. And on behalf of both past governments and the current government, I apologize for that. I think that's a necessary step so that we can take the action we need to do now to move forward.
And so whose responsibility ultimately is it? I mean, the Premier always says the buck stops with him. Was the Minister of Long-Term Care then punished for what happened in long-term care, or is the Premier, where is the responsibility here? Where does the buck actually stop?
Yeah, all of us in government, and again, as anyone who's read the Commission report sees, that it was over decades that this sector was neglected, that investments weren't made. And so accountability rests with all of us who've been in government, and as I said, governments past, but also governments present. The really important question, and it's the question I've been having from advocates, from the sector, from union leaders, from all the people I've talked to, is the important step of taking responsibility for fixing this. And that's also what Premier Ford said. Our accountability is to make this better going forward, and we will do that. Jamie?
Those are easy words, but how are you going to do it? Are you going to turn the apple cart upside down and start from the beginning? Or are you going to continue to allow for-profit homes? Or there's a lot of things going wrong.
Listen, I'm just over 1 week into the job, and so you'll appreciate that I'm getting the full grasp of everything. But we're blessed with reports from the Auditor General, from the commissioners. I've spoken to the 3 commissioners. They were very generous with their time, and I think provided a lot of insights. The Auditor General did as well. We've had other reports before that. As you know, we've made significant investments, $4.9 billion in terms of improving staffing. And I have to say, both the Auditor General and the commissioners indicated that at the top of a long list of things to do, staffing was important. Over $2.6 billion for capital improvements. But we'll also be needing to make changes from a legislative point of view. So in the fall, we'll be bringing forward a legislative agenda that looks comprehensively at the Long-Term Care Act from 2007. I think the map, though, and a lot of the work in terms of where the priorities lie has been laid out quite clearly by independent commissioners and independent officers and other work that's been done by the ministries in advance. And now the job the Premier has asked me to do is to act on that, and to act on that in a timely way, both for the short term and for a longer term change. There are major changes in the system, and it will take time to change it, but we will do that.
With baby boomers peaking very soon, the number of people that are going to be using, time is not your friend here. Are you going to be able to make them faster, or are we just going to see a continual pile up of problems?
Listen, there are close to 40,000 people on wait lists today for long-term care facilities. And so that's why the urgency of the building programs we've put in place, including the rapid builds and other programs, are so important. But this isn't a problem we can't solve. And I mentioned in my comments, I've really been impressed by the goodwill of, and folks who are friends of the government and folks who sometimes criticize the government. But people understand that now is a time for making these changes. So we are going to have to run fast and run in the right direction and run smart. But the Premier's made this commitment, and I'm making this commitment, that we'll make the changes necessary. That doesn't just include long-term care. We're talking about a continuum of care. We're talking about home care. We're talking about other aspects of Ontario health teams. I look forward to working closely with Minister Elliott and have had several conversations with her about how we will work together on these things. But it's a big task, but it's not beyond us.
What do you think? Let's go ahead.
Questions?
Sure.
Rob Ferguson, Toronto Star.
Hi, Minister. Welcome to your new portfolio and all these questions. Just wanted to ask about the vaccination levels. They're getting better, but there still seems a cadre of people who don't want to get the shots. Why can't you do more on that front to get people to take shots? Today, for example, we've seen another hospital system in the States, the Henry Ford system in Michigan, require all its people to get vaccinations. Why can't that be done here?
Listen, as I said, I'm new to this portfolio, but I'm open to all solutions. And at the first and foremost in our mind is going to be the safety of residents and staff. That said, on Thursday, Ontario will be the first province to put forward a very disciplined vaccination program where staff will need to either demonstrate vaccination, demonstrate a medical reason, and we do know that there are people who have medical reasons why they can't be vaccinated, or undergo some education so they understand the importance of vaccination. I frankly am impressed, and I want to commend the staff, the PSWs, the nurses, the administrative staff in our long-term care homes. I think we're seeing a lot of effort. If we think that we have 93%, I think as of today, staff that have one vaccine, that tells us that we're doing a good job and that staff are responding. But again, I'm open-minded. We need to protect staff and we need to protect residents. And I think we're making good progress, but we will continue to have to make progress or we'll have to do more.
Just following up on that, I was talking to a doctor on the weekend who mentioned that we need to be ready for the next pandemic. And no one knows when that will be, of course. The problem is there might not be a vaccine for the next pandemic. So that would leave nursing homes as vulnerable as they were at the start of COVID-19 almost a year and a half ago. So what do you need to do first to get nursing homes ready for the next one?
You know, it's absolutely the right question, and it's why I was so interested in the conversation with the long-term care commissioners. They evaluated the advice that the Ontario government received after the SARS epidemic, after the H1N1 scare, after the Ebola scare, and all of those were situations where a vaccine wasn't immediately available. And so the kinds of changes that we need to make in terms of physical infrastructure. I mean, we're looking at a system where between 2011 and 2018, only 611 net beds were built, and redevelopment was almost non-existent. And when you look at some of the challenges in the homes that had more deaths, it was because we were dealing with old infrastructure. So we need to convert the infrastructure. We need to embed infection prevention and control as part, and again, these are recommendations that have come from multiple sources. We need to make sure that inspections are not only responding to complaints, but also proactive. Clearly, there needs to be a framework and a changed framework to make sure that those responsible, those who are operating the homes, understand their accountability and that there's an inspection framework that's proactive. So there's a number of items. It is quite likely, as you said, that any future pandemic is not going to come with a vaccine attached. It is literally a miracle of modern science that we have the vaccine we do so quickly this time. And we're certainly hopeful about that in the future. But we need to make sure those steps are taken now. The advice was given by various commissions, by other people in the past. And as I said, successive governments didn't take it. So we're going to take it now and do that work.
Next question.
Next question from Dave Willard at AM 640.
Good afternoon, Minister. Thanks for taking my call. I'd like to talk to you about air conditioning in long-term care homes. Your predecessor said that she'd hoped to get up to 83% of all rooms air conditioned as soon as possible. Are you able to tell us if we're at that point yet? And if not, what's the holdup?
Sure. Great question, and I'm happy to give you an update. So, as you'll know, 100% of the facilities have air conditioning, but there's a difference between that and air conditioning in the rooms. And that's so vital because many of the patients aren't able to easily leave their rooms. At this stage, we've managed to have 60% of the facilities have in-room air conditioning. And in the immediate term, we will be getting another 23% that are being air conditioned on a unit by unit basis. This is an important priority. Of course, on a day like today that's sweltering, we can only imagine discomfort, and discomfort for our most vulnerable is not something that we can tolerate. That's why this government has put $105 million into this. And I've asked my deputy for weekly updates on our progress. So at this point, we are working on that next 23% and working with Infrastructure Ontario and, of course, the homes to see that installed. There are a final section of our long-term care homes that, because of their age, have more complexity. So this is a priority for me. We don't need the hot weather to remind us, but we have it to remind us. And again, I've asked my deputy to keep me up to date, and this will be one of the things that I'll look forward to giving regular updates on.
Okay, thank you, Minister. Also, advocates say that one of the big problems surrounding getting air conditioning into all of the rooms is a standard that the province has for building new homes that doesn't require infrastructure for cooling mechanisms to be in place. So, Minister, why hasn't that changed if the goal is to get every room air conditioned?
So this is an important question around design standards. It's one that I'm reviewing. Obviously, the objective is to make sure that the rooms are cool. And that's where we start. The need for a specific unit in each room, or the ability to control the temperature in each room, is our ideal objective. But at a minimum, we need to make sure that the design standards, and they do today, ensure that the rooms are cooled. But again, this is one of the areas that I've asked that we review. We want to make sure that we're setting a standard so that we don't end up falling behind as we have in the past, and that the rooms are comfortable for our elders.
Go to the next question.
From Jessica Smith at Queen's Park Briefing.
Hi, Minister. Thanks for taking my question. The apology that you offered earlier seems like a very significant step. So I was wondering if you could clarify a little bit. What exactly are you apologizing for when it comes to what the current government did or didn't do?
My apology. Anyone who's read the Commissioner's report sees it's self-evident that things could have been done better and should have been done better. And certainly that goes back, our government took over a system with aging infrastructure, with an inspection regime that was out of date. We were the first government in almost a decade to hire new inspectors with the systems and standards that simply weren't up to the mark. So, we will make sure that we, deal with this and that we correct it. But, first and foremost, there was, 3,782 people lost their lives in long-term care homes as a result of COVID. That's clearly not a standard or something acceptable that this government or previous governments can be proud of. So, I say that, we will do better, and we have to, but I think it's important to acknowledge the challenges and the failings of the past so that we can now turn the page and move on.
Thanks. To follow up on that, you've made some comments about legislation that's coming and improving the sort of inspection and compliance regime. Can you elaborate a little bit on what might be coming? And will any of this include addressing something advocates have been very critical of, which is when homes have serious problems, they aren't really given any kind of consequences with serious teeth? Is that something your government plans to address?
The regime going forward, and some of this will involve legislation, some of it doesn't require legislation, but there certainly will be legislation in the fall and a new long-term care act. But it needs to create the framework within which it's very clear to operators, whether they're for-profit, municipal, not-for-profit, what their obligations are and what the implications are. From an inspection perspective, we have been, for a variety of reasons, less proactive about inspections than we needed to be. So, of course, this will come forward as as part of the policy process. I wouldn't want to predetermine that. I've had the benefit of a number of conversations in my first week on the job, but it's important that we consult, that we speak directly to affected families, that we speak to residents, that we speak to the operators, that we speak to the representatives of the staff and their unions, and have started those conversations. But we want to make sure that it's clear who has obligations, and then we'll hold them accountable for those obligations.
Thank you, everybody.
Okay. Anything more in the room? Or? Okay. Thanks, folks.